future of psychiatry or psychology, whatever you want to call it, is it in a medicine cabinet? Is it cognitive? And how can you make a diagnosis?
So recently I joined it's not really only an online group, but it's basically going to meet mainly online and maybe once a year in person. A group of psychiatrists and allied professionals who really believe in returning psychiatry back to its roots of psychotherapy. So joining psychotherapy and psychiatry. And the other component is going to be neurology.
But do you have enough time to do all that, to see patients for that long, for the time necessary?
Well, I have the time to do it if I can be reimbursed for it.
That's the question.
So reimbursement is the problem. If you're going to pay me for my time, I'm happy to do the work. I know a lot of psychiatrists who feel as I do. There are plenty of people doing what they call psychotherapy, which is basically like your friend telling you, don't worry, take it easy, it's okay, he wasn't worth it, you know, kind of folk treatment. But the real integration of psychopharmacology with psychotherapy, and there's a name for what I do actually, I learned this from the person who started this group. It's called psychopharmacological psychotherapy.
So again, it's drugs, it's talk therapy, it's a study of neurology, or you get a background, you continue to study neurology?
Well, neurology is, right now there's a split between psychiatry and neurology. And the way that I defined it or described it in my book is the split between things that have some kind of...
The name of your book, please?
Forensic Psychiatry, A Lawyer's Guide. The way that traditionally psychiatry and neurology have been separated is neurology is more with physical behavioral types of problems, psychiatry is more emotional behavioral types of problems. And the other difference is that neurological problems, if you look hard enough, you can find something physiologically wrong. Like if you pry the brain apart enough down to the molecular level or down to a slide, even after the person is dead, you can find something wrong. Whereas in psychiatry, a lot of times you still can't find anything wrong, although that's changing. Every day there's studies published where they can't find something wrong. So eventually they're going to be one specialty, although right now that's not practical. There's still separate residencies, it's still separate training, and it's too much to learn, all of that stuff. It's just way too much material right now. But to combine the discipline of what happens inside your brain with the discipline of the thinking that goes into it, that's eventually going to become the appropriate treatment. And when that happens, we can get people better.